Hi guys, today I just wanted to talk to you about one of the key components of lifestyle medicine that we don't really talk about too much. So most of us know that the fundamental concepts of lifestyle medicine are good nutrition, frequent movement, restorative sleep, reduction of stress and anxiety, and avoidance of toxic substances. But one of the most important parts of lifestyle medicine is also happiness. And happiness is a huge part of whole health and promoting overall wellness. So I wanted to talk to you specifically about happiness with regards to career, and then my own personal challenges and story and how it connects to this. So basically, I went to medical school with the intention to study primary care, so internal medicine or family medicine, because that's really what I knew. I knew my own pediatrician, our family doctor, my parents' doctor, and I aspired to be like them. I admired them, and that was my plan. But when I went to medical school, things changed, and I'll get into that a little bit. And I ended up going on a completely different path and studying radiology. And in the process of that, I realized that that was not the right decision. And I basically, made the decision, a difficult decision, to switch into internal medicine and complete my residency training in internal medicine. So I just want to say that, to all of the people out there who are feeling stuck in their field, and I'm specifically speaking to medical students and residents in training, just because that is my personal experience, but this is really for anyone. To the people out there who are feeling stuck, you're not stuck. You are able to leave and to switch to a different career path at any point, and you should not feel like you're trapped. So let me just back up and say, I finished my 4 years of undergraduate training, my undergraduate degree at Stanford, and then I moved back to my home city of Philadelphia, and I went to medical school at Jefferson Medical College, and I, again, was expecting that I was going to be either in internal medicine or family medicine, but I ended up connecting with a mentor in breast diagnostic imaging and radiology, who was absolutely extraordinary. And she really, influenced me a great deal. And, she, through just working side by side with her, I realized maybe what I was thinking all along wasn't the career path that I was meant to follow. So let me look more into radiology. And, watching her day by day, seeing her do her stereotactic breast biopsies and read breast MRIs, breast ultrasounds, mammograms, and then participating in tumor board with her, multidisciplinary approach to patient care, where, surgery, pathology, radiation oncology, radiology, oncology, all these teams work together on complex cases to find a best possible solution to help patients get better. It was really amazing to me, and it was something that I wanted to be part of. So, I ended up changing what I thought I would be doing. I ended up changing because of this amazing mentor and saying, let me apply and see what happens. And I ended up applying to radiology and matching, and I was ecstatic. So I ended up going to Boston Medical Center for my first year of internal medicine internship, and then heading to Pittsburgh for my radiology training. And, almost 2 years into training, I was like, this doesn't feel right. Like something's missing. And it was the patient contact. The best part of my day as a radiology resident was inviting other teams to come down to the reading room and looking over the findings with them, going over CAT scan results and trying to clinically correlate the findings and, try to help in the management of patients. And I realized I was sitting in this reading room and reading, CAT scans and x-rays and just feeling like something was missing, and that was the patient care, the patient connection, so that patient interaction on a regular basis. So I was feeling trapped. I was feeling guilty. I was feeling like, how can I get out of this? This is what I have to do because this is what I matched in. You think to yourself, like, they basically, they wanted me and I wanted them, and I have this spot. And, as in the medical training world, it's like you invest so much of yourself, so much of your time, your energy, your money, your blood, sweat, and tears. And it's just like, you finally end up matching into a field and you're like, this is what I have, like, this is what I'm going to be doing for the rest of my life. Like, I made this decision and I have to stick with it. But that's not the case. So I just want to share with you, like, I found the courage to, basically go talk to my program director and tell her, like, this is an amazing field. Like, for a lot of people, they find it, ultimately fulfilling. But for me, I feel like something's missing. And they were extremely supportive when I went to talk to them. And they want you to be happy at the end of the day. Like, nobody wants a person in their program to be unhappy or not, in the right place. So they supported my decision. I left. I went to finish up my internal medicine training at Lenox Hill Hospital. And, my message is basically that you should trust your gut, you should trust your heart, trust your instincts. And, that time that you spent in something else is not lost. I used the knowledge of my radiology residency to help me in my internal residency training. I used to pull up CAT scans and x-rays on the floors in the hospital or in clinic and look at x-rays and read them and, read studies before the radiologist had seen them. And it was really helpful, really, made my life more efficient, and, made me able to practice excellent patient care. So please, no matter what field you're in, don't feel like you're stuck. And ultimately, you want to use your skills, the blessings that you've been given, to help people to the best of your ability. And, when you find that fulfillment in your career, that's going to directly correlate and translate into fulfillment in your personal life. So happiness, is going to, the happiness from your career is going to, you're going to feel that from your professional career into your personal life. And that's all part of whole wellness. It's all part of lifestyle medicine. It's all part of whole health. So I hope that you found this helpful. And, to anybody out there who is having that struggle, I totally understand. I've been there, but, find it in yourself to make a change, and it's not too late. And, the people who care for you and who matter will support you in your decision. Okay. Take care.